It's very common in patients who have severe head injuries to be put into a pharmacological or medically induced coma. Once a patient has sustained a severe head injury, their brain is very vulnerable to further damage. And sometimes that damage is because of progressive swelling of the brain, sometimes from other causes. And we have a number of different ways of trying to control that intracranial swelling to try and provide the most optimal environment for this vulnerable and or damaged brain. An intracranial hematoma is, in very simple language, a blood clot. And within the rigid confines of the skull, a blood clot can cause dangerous pressure on the surrounding brain. A blood clot may be on the surface of the brain, between the skull and the brain, or it may be within the brain substance itself. Both are extremely dangerous situations because in both cases, the expanding blood clot causes dangerous pressure on the surrounding brain, and in almost all cases you need to remove that blood clot as soon as you possibly can to prevent the patient either from dying from the pressure or from sustaining a permanent injury to their brain. Anybody who sustains a coma-inducing head injury has sustained a very serious injury and a very serious insult to their brain. It's impossible to know at this stage what the outcome will be. And at this stage, there's a specialized team of people looking after him, which are not just the neurosurgeon, but also the intensivists, anesthetists, and other support personnel. And that team-based approach is what yields the best results. I think anybody that sustains a coma-inducing head injury is at risk of a permanent neurological deficit. It's just impossible at this stage to say what that deficit will be. And really at this stage what you're hoping for is survival, and then from there you go look beyond that.